It's day 10 of Interstitial Cystitis Awareness Month, and today we're going to dive into invasive treatment options for IC. If you're new here, I'm Callie. I'm a registered dietitian specializing in IC, and for the whole month of September, I'm making daily videos that educate you on little pieces of information about IC. In the last video, I talked about non-invasive treatment options, so today we are going to do the invasive ones. Now, there used to be a hierarchy of treatment options from first-line treatments, which were the least invasive options, down to sixth-line treatments, which were the more invasive ones like surgery, etc. The American Neurological Association recently did away with the hierarchy, and basically their recommendation now is to have a collaborative conversation from patient to doctor about what the right treatment plan looks like for you. Is this a good thing? I honestly don't know, but we will find out in the next few years. When it comes to the treatment options that are available to you, when I say invasive options, I mean options that involve going inside of your body and using a catheter, any sort of injections, things like that. So one option is installation. So installations are when your doctor will insert a catheter into your urethra and your bladder, and they will put liquid medication inside of your bladder. So it gets instilled, and you hold it in your bladder for 30 minutes to as long as you can. It just depends what your doctor prefers. A lot of doctors will have you do a series of installations and then reevaluate if it's helping. Another option is a hydrodistension, which is essentially a procedure where they put you under anesthesia, they put fluid inside of your bladder to essentially stretch it and basically damage your nerves. When it comes to hydrodistension, the reviews are a bit mixed. So about 50% of people find they're very beneficial. The other 50%, which I fall into, it makes things worse. This is why we want to push off invasive treatment options and start with the less invasive options. Another invasive option would be Botox injections, either inside your pelvic floor muscles or into your bladder. The pelvic floor muscles can be done inside of just a regular office. I've had it done twice. It's pretty painful. And then the other option is to get Botox in your bladder, and that is a bit more risky. You run the risk of having issues urinating. So again, pretty risky. Okay, I'm running out of time. If you have any questions on the procedures that I just talked about, drop it in the comments. If not, keep following along for day 11 of this month.